Good morning, people. How are you?
Fine, thank you.
Thank you.
Looking good as always. And I kind of like your topic for today, art with heart. Side rhythmic, and I know it's something everyone would really want to understand what you want to talk about it with your guys. So you have the floor now.
I always have very nice catchphrases, don't I?
Yes, indeed.
Morning, let's go now. Morning, viewers. Art with Heart, a call to young Nigerian artists to inspire healing. That's what we're talking about. Good morning, viewers. Together we fight, together we win. So let's start. Every child deserves a chance, not just to live, but to heal with hope, color, and comfort. At the University of Abuja Teaching Hospital, too many children facing cancer walk away from treatment, some because the journey is too hard, too lonely, too overwhelming, to name just a few. But what if the walls could speak? What if they whispered, "You're brave, you belong, don't give up"? Welcome to Kakaki Cancer Awareness in partnership with AIT and Common Cancer Foundation, a platform where compassion meets action. My name is Dr. Denise Ejo, the CEO of Common Cancer Foundation. Good morning, ladies. Let me go like this. Good morning, Dr. Fejiro. Good morning, Dr. Ofio.
Good morning, everyone. Dr. Denise, nice to be here.
Did you see what I did? Okay, so we're going to go back again. I'm going to ask a question. So, Dr. Fejiro, what do you want me to call you? How am I supposed to address you throughout this?
Dr. Fejiro is fine.
All right, then. Dr. Ofyong, how do you want me to address you throughout the conversation?
The way you started is okay.
Which one is that now? Dr. Udwak, right?
Dr. Ofyong. Dr. Ofyong's okay.
Sorry,
which one is easier for you? Udwak
so long as you just permit me that if I get it wrong, you don't get upset with me today. Okay, let's go. Today we continue to honor, as I said, cancer survivors. This month is Cancer Survivors Month, which you know I am one of them, and I am celebrating. We are all celebrating resilience, hope, and the incredible journeys of those who have faced cancer, and children are not an exception, and we will continue to win. Our episode today is one of hope, youth empowerment, and creativity. So today we will discuss the launching of a powerful initiative, a mural competition for young Nigerian artists, one that aims to brighten the walls of young Nigerian artists, of the Pediatric Cancer Award at the University of Abuja Cancer Center, University of Abuja Teaching Hospital. I don't know how that name is called. How do you call that place? Is it called University of Abuja Teaching Hospital Cancer Center? Is that how you call it?
It's University of Abuja. It's a ward, so it's just our oncology ward.
Oncology ward. Okay, that's how it's referred to. Okay, the oncology ward. So, I'm going to make the oncology ward. So everybody, viewers, you know me, and these children matter. These children matter. They will make noise. Okay. And lift the hearts of every child who walks through those doors. So, joining me today are two remarkable guests whose work continues to shape the healthcare. So let's go. Dr. Fejiro is the Managing Director of the Nigerian Solidarity Support Fund and a medical doctor with Global Health and a Global Health Executive with expertise in stakeholder engagement, program strategy, and resource mobilization. Thank you, Dr. Fejiro, for joining us today, and I look forward to this conversation.
Thank you for having me, Dr. Denise. Thank you.
And I've got Dr. Ofyong. I will get it right. Consultant pediatrician at the University of Abuja Teaching Hospital. That's in Guagalada. She's a dedicated clinician and a fellow at the West African College of Physicians. Dr. Ofyong, good morning, and thank you for joining me this morning.
Good morning. Thank you for having me. It's nice to be here.
Don't mind me. I'm quite ruffled this morning. I have my surgery. I think that's why. So together we fight, together we win. Let's start this conversation, and I'm going to start this conversation with Dr. Fejiro. Dr. Fejiro, let's start with you. Let's go. what inspired? Now, let me go back. NSSF. You're going to explain all that to us, okay? NSSF and your partners to initiate this mural project, and why is art seen as such a powerful tool in healthcare space? Now, you're going to start here because I have a different perspective. So let's go.
Thank you, Dr. Dennis. Thank you for giving us the opportunity to share the work we are doing in the cancer space today. NSSF is an NGO in Nigeria that focused on addressing pertinent health issues through advocacy and policy development. We've been here since 2020, started with the COVID, and now we're addressing issues that are very important to the nation. And as well as building our youth's creativity for health in Nigeria. So NSSF, in collaboration with BVGH and Medicaid Cancer Foundation, sought to come together to address this overlooked challenge in pediatric cancer care, which is treatment abandonment. We found out that beyond the access to care, beyond the finances being a reason why children may not continue their cancer treatment, one other very common problem is because of the emotional toll that it has on a child. We know that cancer is a marathon. Cancer treatment is not a sprint. And we know that children may not be able to, stay the long haul. They don't have that resilience or emotion, and nobody really, even adults, has that. So as a result of these emotional and psychological reasons, we have 70% of children diagnosed with cancer in Nigeria not completing their treatment. And so we decided that what can we do about it? How can we bring emotional uplifting and make the where they stay to receive the treatment, the ward, the oncology, the pediatric oncology ward, how can we make it emotionally friendly to children? So we decided to use the power of arts. And so we initiated this campaign where young artists in Nigeria or creatives that are, you don't have to be a muralist, that are into art and paintings, will come up with an idea that inspires strength and that inspires hope in children and give them that environment and turn the UATH pediatric oncology ward to an environment that inspires hope for them, that brings that emotional healing, that makes them relax, and so that they can, go through this treatment process and complete it, and hopefully, get the all clear at the end of the day. We know that art will not bring the cure to cancer, but we know that it can bring that emotional healing which they need, and bring that hope and belief, which is a first step to treating cancer. So that's why we're here today.
Thank you. Okay, I will come back to you on it, because one of the things that is very key in this conversation is for someone who has the disease, and I'm not a child, I have come to realize that all the things that make us that have the disease get through this is everything else that people don't want to talk about. So art is one of them. Art is something, and I'm not looking at art as just fine art. I'm looking at art as the entire thing about art. But let's go. Dr. Uduak, you work directly with these children, and that gives my heart, I'm very happy with that, because now we know, we're the ones that know what's going down. How does the hospital environment affect a child's emotional state during the cancer treatment? And I'll be honest with you, I don't think I can ever visit that hospital because of it. But any cancer center that has children, only because I have the disease. But I cannot imagine how you do this. How does the hospital environment affect their emotional well-being?
Thank you. I guess that once a child is removed from an environment that is common they're used to, into a strange environment, they become agitated. And then seeing different faces, and how the white coat and the nurse's uniform already frightens a lot of children from immunization and all that. So it really makes them scared. And also their parents get worried because of all the activities that are going around, the blood taking, the line setting, and all those things, and asking them to do one thing or the other in relation to the treatment of the cancer. So I think not just cancer, any disease at all. Environment is very frightening and it's discouraging, especially, we have open wards. So children of different disease entities are there. And, our cancers can vary from mild to very grotesque. And then you're all in the same ward. We don't really have separate wards for them. So seeing all these things, parents get discouraged. A child dies, parents get discouraged. And for the older children, it's like they wait, will I be the next, or things like that. But so the environment generally is scary, it's frightening, it makes them really want to go home. And a lot of my patients have said that they wanted to go home and they don't want to stay anymore. So it takes a lot of effort to keep them, and even the parents to keep them. Once the children begin to agitate, they want to go back to their brothers, their sisters, because they can't come to the hospital. So it's daunting for them. So that's how the environment usually is. So it's good to have more, to let them see things that could make them happy.
Yeah, I think I can relate to that. Yes, I do relate to that. Because going into the cancer center is, no matter how nice it is, it's very daunting, even as an adult. So I can imagine, or can I actually imagine how they see it? But let's look at it from. So we understand that about 60% of the pediatric cancer patients either don't begin or don't complete treatment. Can you speak to the reasons? You've just talked about all the things that the parents and the issues going on. But if I'm sitting here and thinking about it from my perspective, even I, as an adult, I'm not going to tell you a lie. I've actually said I don't want to do treatment of recent. So I'm able to. How do you get through to us? I'm trying to get my head round. I'm an adult, and I'm trying to say I'm not doing anymore. So how do you get this through for children?
One of the reasons why parents don't want to start or don't abandon treatment is finances. So for us in UATH, in the last 3 years, Okapi Children Cancer Foundation has been a great support for us. So it keeps parents, give them hope for some financial help. So that's one. Then the other thing is we have to how do I put it? To get parents to stay by giving them adequate counseling even before we talk to them about the treatment plan. We give them adequate counseling, and we also use survivors. We ask the parents of survivors, those ones that are older, those ones that are younger, to come and talk to the patients to show them that treatments can prolong life. Like I have one particular child, he came in at 2, now he's 14. So the mother is always willing to come talk to parents who are agitating or who don't want to start treatment. So we use our survivors to talk to parents. Okapi Foundation supports us, and we give them counseling with respect to what they should expect. So when these things come, they wouldn't be surprised. And we have literature to also help us talk to the parents. So I think that helps.
Thank you. See, what you just said now just helps but we need more of the Okapis now. I know, but I know.
Yes, we really do.
We really do need more of your cappies. And maybe a call for people to help us to get more NGOs working with children, or maybe we use advocate NGOs to help. We'll have to come back on that conversation some other time, because honestly, there must be a way around. We do get cancer patients do get what you're talking about. So we will identify what you just said, and that makes sense. So it's how do we move forward? Dr. Fejiro, what role, therefore, do you believe a hopeful, peaceful environment can play in encouraging families to stay? Because as you've heard, there are key issues that make us not stay. And it's nothing personal to any doctor or hospital. It is actually our reality. So I can imagine, I'm talking as an adult, what the children or their families are going through. And that is a reality through this treatment, and how they find the strength to fight. Because it's to fight.
Thank you. It's been an interesting conversation. I think in the last few decades in medicine, they're introducing a lot of more emotional support to medicine. So for even non-communicable diseases, for people dealing with chronic illnesses, they're talking a lot more about support groups now, because we know that beyond the treatment, beyond the access to care, which could be finances and all of that, people, if you don't have that positivity or hope or belief, then most times, in fact, even emotionally, the drugs don't work. When you've given up, the drugs don't work. So this is a new space of medicine where we are dealing with our minds, where we are dealing with the patient's mind to fight the illness, to participate. Because if you are the care provider, you can't do so much. If the patients don't want to take their drugs, I remember as children, sometimes we keep the tablets, we don't take it, we throw it away, we hide it, So the patient must be first their own primary caregiver. They must believe that they can fight this. They must believe that this is not the end. They must believe that there is hope. If there is hope, if I cooperate, there is hope. There is like she said, there is good news. Not everything ends up as bad news. There is good news. I can be among the survivors. So visual arts is to help even the caregivers, the parents, to be hopeful, to receive strength again, to not feel alone, to feel like, there are so many other people that are also going through this. So you're not alone. It's not peculiar to you, and you can fight with us. You can fight with the care providers, with the doctors, with the nurses. You can join us and fight this illness. I think that's the greatest thing that this morale will do for them. Just that strength and that hope to say one day at a time. Let's take it one day at a time, and let's push for this. We can see that with this, in fact, studies have shown that there's higher engagement of the patients brings about more positive results on the illness. So we want that engagement from the participants, even though they're children. So making that child-friendly, that hopeful environment, ultimately we hope that it will make them stay through course of their treatment.
Okay, now you got 1 minute to tell us about this program. This 1 minute.
Okay, this is calling to all young accessed between the ages of 18 and 35 that live in Abuja or around Abuja, so the environs of Abuja. And you know that you want to inspire hope in children. You want to inspire resilience. You want to inspire strength in them as they go through their oncology care, their cancer treatment. Register in our official campaign link. Is in all of our social media page. You can scan the QR code that you see now. Create a 2 to 3 minutes video showing us your mural concept, the creative process, and the story behind the work. and then post it on social media, tag NSSF We Niger, using a hashtag a mural of using the hashtag a mural of hope. So tag NSSF We Niger and use the hashtag a mural of hope and make your profile public. We would then screen. The last day of submission is July 12th, 2025. So we have a few days, a few weeks to the close of the contest. The winner would get $500 as a gift prize, and all of the supplies they need to paint this art in the cancer ward, in the pediatric ward. So they'll get all the supplies and they'll get a cash gift of $500. Thank you.
Thank you, Dr. Offiong. What do you have to say to end this?
I think the art is very pertinent to giving hope because, children just generally like colorful things and stuff like that. Currently, the ward, though it has two colors, it's not the kind of color that brings excitement to children. So I guess when children step into a ward and see a beautiful mural, a little bit of the agitation may be off. And then even if we through all the process, they continue to see that. And if it has meaningful things, like some of the things you have mentioned, the parents can also make reference to it. So it'll be good.
Thank you. I'm sorry, our time is up now. Thank you, everyone. Thank you, ladies. Thank you, doctors, for being with us. And thank you, our viewers, everybody watching out there. There's a competition out there. Please win this money and get a painting. Get this hospital children's ward looking very, very nice for us. Together we fight, together we win. I want to thank you both for joining us, and to our viewers, follow the hashtag, follow all the information. You'll find it also on the AIT platforms. You will find the adverts on this program. We look forward to seeing you again in 2 weeks. Let's creative using humanity.
Thank you.
Thank you.
Thank you so much.
Bye.
See you all next 2 weeks, viewers. Follow us on all our social media handles and Cornwood Cancer Foundation.